Thanks. Good morning. I'm delighted to be able to be here. I'm going to, like Tony, talk very fast because I have more to say than I can say in my allotted time. And also, Cindy asked me to talk about health and all policies and urban forestry, and then she sort of slipped in at the last minute, and maybe a little bit about climate change, which is my true passion. So I'll try and slip that in. I'm going to try and sort of move from what have been some really big ideas. Tony presented his framework for health, just talking about the whole concept of resilience, talking about some of the evidence for why trees are important, and move to talking about some of the recent efforts in the state of California that are being replicated now in localities around California and the nation to take these big concepts and actually put them into action. So Tony talked a lot about equity and the disparities in health outcomes and life expectancy. And what we know from many, many studies now is that the biggest determinants of health outcomes are the environments in which people live, learn, work, study, play. I used to be the health officer of Berkeley. We always added and have sex. And some neighborhoods look like those on the left, and others look like those on the right. And pretty consistently, we know that the neighborhoods on the left have significantly lower life expectancies. Tony showed you how significant those can be. And the ones on the right have much better life expectancies, fewer people with obesity, lower rates of diabetes, fewer children with asthma hospitalizations. You can go down the list of any health outcome in any community across the entire country. If environments determine health, our current health and healthcare systems aren't working to address those environments. Because as I work in a local health department, or I work in a local clinic or a local hospital, I'm not making decisions about traffic flow. I'm not making decisions about how many trees are planted in a school. I'm not making decisions about how many liquor stores there are in a neighborhood or what the speed limits are. So in fact, I'm only looking at the outcomes. I'm not dealing with the root causes of illness. And that knowledge basically has led people over time to say, you know, if we really want to address the health of populations and improve the health in our communities, we need a new approach. We need an approach that doesn't keep each decision in a silo where you're only looking at one particular thing. We need a decision-making process that's not thinking only about my mandates, but it's also thinking about how what I do relates to what the person down the hall is doing. We need a decision-making process that takes into account what people know about their neighborhoods. There's no one that lives in those two very different neighborhoods that doesn't know that if they're in the crappy neighborhood, they'd prefer to live in the nicer-looking neighborhood. And there's no one that lives in a beautiful tree-lined neighborhood that's quiet and that doesn't have a lot of liquor stores on the street. They don't want to move to that other neighborhood, too. So we need to take advantage of that local knowledge. We need to have an orientation that isn't so short-term in nature. And if we don't take a new approach to the way we make decisions, we're not going to be able to unlock these what we call wicked problems, very interconnected problems, things like inequities, ecosystem collapse, climate change. So we think that one approach to addressing wicked problems is what we call health in all policies. And health in all policies is a collaborative approach to improving the health of all people by incorporating health considerations into decision-making across sectors and across policy areas. And the goal of health in all policies is to make sure that decision makers are informed about the health, equity, and sustainability consequences of different policy options during the policy development process, with a hope that if they're better informed, the policy outcomes will better reflect what those consequences are. Our prior governor, Governor Schwarzenegger, created a health and all policies task force in California through an executive order in 2010. He did this on the eve of a childhood obesity prevention summit with President Clinton. And it created a task force under the auspices of the cabinet-level Strategic Growth Council in the state with 18 different agencies, very, very, very diverse agencies. The first thing that this task force did, with a lot of input from public workshops and discussions with local health departments and community-based organizations around the state, was ask the question, well, what is a healthy community? If we know that community environments determine life expectancy and health outcomes, what are the components that make a community healthy? And we came up with this framework. I'm sorry that it's too small for you to see, but basically it says, we need communities that meet the basic needs of everybody. Healthy access to healthy food, access to healthy transportation, access to good schools, access to child care. We need communities that have a good environment, minimized toxic waste and toxic exposure, clean air, clean drinking water, and the little red line that is barely visible on this basically says parks, open space, and a healthy tree canopy. People need adequate levels of economic and social development. We need health and social equity because not only do people in the lower rungs of the socioeconomic ladder fare poorly, the more inequity there is, the more inequitable the distribution of wealth in a community, the worse the health outcomes for everyone in the community. And we need social relationships that are supportive and respectful for people across all stages of life. The next thing the task force did was basically say, okay, let's pick out a few of these areas and develop aspirational goals. Let's say, what is our vision for the people of the state of California? And our aspirational goal for open space was that all California residents have access to places to be active, including parks, green space, and a healthy tree canopy. And then we came up with a report that had a whole set of recommendations in each of these areas for what could state agencies do to actually move closer toward these aspirational goals. So I want to acknowledge John Melvin, who's sitting in the back there, who is one of our key strategic partners from CAL FIRE in helping develop an implementation plan for urban and community greening and access to green spaces. I'm not going to go through in great detail what this plan looked like, but it really was a way for people from across multiple different agencies to sit down at the table together and say, okay, how can I incorporate just a little piece of making California greener and having California have a healthier tree canopy across many communities by incorporating this idea of urban and community forestry into what I do in my department. And we had a lot of departments sitting at the table: the Governor's Office of Planning and Research, CAL FIRE, the Department of Public Health, the Parks Department, staff from the Strategic Growth Council, the Housing and Community Development Agency, the Air Board, Cal EPA, all just talking about, can we help this effort to make California communities greener? For each of and this process went on for all of these other areas as well. How can we get more access to active transportation and transit for California residents? What can state agencies do working together to improve access to healthy and affordable food? In each of these implementation plans, we tried to pay attention to 4 really important cross-cutting themes. One, this is only going to work if agencies work together, so we want to make sure that there's collaboration both among agencies and with non-governmental partners. 2, equity. We have to make sure that we're not just doing this for the well-off people in California, but that we're really paying attention to disadvantaged communities. 3, this will only happen if we partner with people in our communities. urban and community greening happens at the local level. It doesn't really happen in Sacramento. Sacramento might facilitate it, but it happens on the ground. And 4, that we need good local data and analysis to support these efforts across the state. So I left the Department of Public Health, where this effort was going on. So I can't take credit for any of the progress that's happened since then. That belongs to John and other colleagues that are continuing to work on this. And some of these seem like small steps, but I can tell you, having worked in the state for close to 30 years, these are big steps to have all these different agencies contributing to this one idea of urban and community forestry across California. Urban and community greening has been integrated into all of the task force implementation plans. OPR now has an urban forestry website, that is much more visible. ARB has included research on vegetation in its report on how to address issues around housing siting near busy roadways and the air quality concerns about putting people next to freeways. And greening was a really key consideration of a heat adaptation work group that developed extreme heat adaptation guidance, where one of their recommendations was to promote and expand urban greening and the use of green infrastructure as part of cooling strategies in public and private spaces as a piece of climate change adaptation. So through this work, which, as I mentioned, is now sort of happening in a lot of California communities, the city of Richmond, Monterey County, San Diego County, LA City, LA County, Crescent City, they're all doing work around health and all policies. Through the work of the state task force and these different local efforts, we've kind of distilled what we think are 5 key elements of health and all policies. So I want to quickly talk about a few of those. I don't have time to talk about all of them. We talked about health earlier and equity earlier, so I'm not going to talk too much about that. But I do want to talk about sustainability. What does it mean when we say that health and all policies is really shorthand for health, equity, and sustainability in all policies? So I forgot I wanted to say one more thing about equity. Tony showed you the life expectancy differences. This is a study that was actually done by the Washington Post recently, and it shows just some of these inequities in urban tree canopy coverage. This is Washington, D.C., where you can see the neighborhood with an 81% tree cover has a median household income of $205,000. The neighborhood with only a 48% tree cover has a median household income of $36,000. Similar work has looked at tree canopy in parks in Los Angeles. It looks the same in any community. This is something for the tree community to address. So I really encourage you to take these kinds of figures seriously. So what is sustainability, and why are we talking about it in the same breath with health and equity? Sustainability is basically the ability to meet the needs of the future generations without compromising the needs of the current generations, or vice versa. Tony showed you this framework for reducing health inequities, where on the far left are social inequities and institutional power that make decisions that impact living conditions. Well, the very same powers and decision makers and systems that create poor living conditions that lead to poor health outcomes, those are the same systems that are causing climate change. Those are the same systems that are causing other environmental impacts, like dead zones in the ocean, like fisheries collapse, like honeybee collapse. So these things are integrally interrelated. And it suggests that the only solutions to addressing all of these interrelated problems are really by together addressing these systems, our transportation system, our food and agriculture system, our education system, and the kinds of isms and social systems that Tony talked about. Climate change itself is the biggest global health threat of the century. It is our single biggest public health threat. It has a lot of direct and indirect health impacts, which I unfortunately don't have time to talk to you about today. But most importantly, climate change threatens the very life systems on which we depend. And all you need, I know it rained last night, but we're not out of a drought yet. And in fact, we may be heading into a mega drought. Climate change threatens our air, it threatens our water, it threatens our food, it threatens our shelter, and it threatens our security. It also threatens our urban forests. Climate change creates a lot of stresses on urban forests, and those stresses actually compromise the ability of the urban forest to deliver not just ecosystem services like helping to replenish our groundwater aquifers or improve the quality of water in those aquifers or to reduce flooding risk, but it threatens the ability of the urban tree canopy to prevent urban heat stress. And we know that there's very significant risks from urban heat islands that are only going to be magnified substantially. It threatens the ability of the urban forest to reduce air pollution, which we know is going to get worse as heat increases ozone levels, particularly in our cities. So I want people here to also think about not just how can we incorporate urban forestry into the work that we're doing across other programs through our Health in All Policies approach, but also how can we incorporate health into urban forestry. One way is by thinking about what the CO2 sequestration potential is of trees, and it varies substantially from tree to tree. Another is to think about the ways in which we can really maximize the co-benefits of urban greening, and I mentioned some of these. Bill mentioned some of them. Tony mentioned some of them. I think most of you are familiar with these. But how do we also balance all those co-benefits with some of the potential risks, and how do we balance the need for trees with other really important needs, particularly in the face of climate change? So this is a quote that comes out of the extreme heat guidance that was recently put out by this multi-agency group. The legislature has mandated the promotion of solar power, even if it requires reducing the amount of tree canopy coverage. How do we balance these different kinds of needs? Because it's definitely true. If we don't kick the fossil fuel addiction that we've got and move on to renewable energy, it's game over. But do we really want to give up trees to achieve that? No. How do we make sure that as we move to having 5 million trees in Sacramento, that we don't increase childhood asthma and allergy? And I know that there's been a theory going around for a while that tree canopy alleviates asthma and allergies because of its ability to clean some particulate matter out of the air and to soak up some of the other pollutants. But I think the most definitive study that I've seen to date suggests that, in fact, tree canopy coverage is positively associated with asthma and allergic sensitization. So, yes, we need to really be thinking about the broad benefits of trees, but we should be doing so with a mind toward looking for trees that have less allergenicity, less pollen, and less volatile organic emissions. We need to make sure we take care of our trees so that we're not creating hazards. At the same time that we're talking about planting trees, we're trying to get people to walk more. You can't walk more if you've got tree roots in your way, and for disabled people, that's a particular problem. We've got to be mindful of the fact that if we're entering into a mega drought, we have to preserve water for drinking. So how do we make sure that we're addressing drought concerns when we plant trees? So Our goal is really health equity and sustainability in all policies. I personally think that one way we can achieve that is by incorporating urban forestry in as many of our policies as we can. We're not going to be able to do that without collaboration, without community engagement, and most of all, we really need to collectively figure out how we move toward societal and government prioritization of health equity and sustainability, and that's only going to happen with really robust democratic processes and participation and social movements like we've seen in the past that have been what have really created the social change that we need to have healthy, equitable, and sustainable communities. Thanks.